and you are almost finished with your
Yes.
PhD in community health sciences at LSU. Tell us about that thought process going from your MPH and thinking through, okay, I want to get a doctorate in public health.
Yeah. So when I was in my MPH program, I didn't necessarily want to go get a PhD. I had some trouble seeing like what I would do with a PhD in public health and things like that. But over time, talking to those mentors, I started to really see how it could really take me to the next level. Like might have even been the difference between, being in a director role or a president role or a CEO role in some of these organizations. And I knew that that's the track that I ultimately wanted to go towards. And so I ended up deciding to apply for the PhD program. And from there, I was able to get internships during my PhD program, which actually led me to my first full-time job, my big girl job in public health at a nonprofit foundation as a director while I was still in my PhD program. So like I said, that networking stuff is really everything.
And talk to us about that progression from working as an intern to going to, I believe it's Director of Impact and Evaluation at Boston Community Resilience.
Yes. So when I first started my PhD program, my chair, who's my chair right now, she came to me and she was like, "Hey, Michelle, there's someone I want you to meet." And I was like, "Well, what is it?" And she was like, "It's an internship program I want you to do. And I want you to meet the CEO of this, the executive director of a nonprofit." And I was like, "Well, okay." So I went to go meet with him and he was great. And he told me all about the nonprofit. And it's so funny. You had to have been there. The way that he was describing it, as if it was already there. We were at a meeting space, like at a co-working office, talking about the vision for this nonprofit, and I thought it was already a flourishing thing in existence. And so he's like, "Well, let me come show you." So I got in the car with him and we drove over, and it was just dirt. Nothing was there. Nothing was there. But I believed in his vision so much, and I knew what my chair was thinking because she saw the thorough line of how well I was able to connect with people who have been through traumatic experiences because of my traumatic experience in Katrina, and then also working with breast cancer survivors, young breast cancer survivors. At that, she saw how I handled everything with tenderness and care that people needed, how I went about data collection and things like that with them because of the experiences that they had been through. And so she knew that this would be a good fit for me working with our veterans who had been through some very traumatic experiences serving our country, a lot of them who came back with visible and what they call invisible wounds of war, which is very real. And in that capacity, I started as an intern and I was writing grants for them. Amari had never written a grant before in my entire life before I started working at Bastion. And I mean, now what is that? These so many, almost 7, 8 years later, Bastion is thriving. They have a lot of families that live there now. And I helped them raise like over $6 million to become what they are today. And I created their evaluation infrastructure in a way that is equity
Wow.
focused and empathy focused because they've been through a lot.
Well, that is awesome. Shout out to your chair for connecting you into that position. Shout out to the executive director having a vision and communicating that so excitingly that you were actually
Yeah.
like, all right, this guy's not crazy. I'm gonna follow through with this. And really seeing the impact in that. And I loved that you're highlighting like not only the hard skills that you're getting there, but the soft skills, like realizing that your chair saw that you were able to appreciate and be tender and soft and know how to communicate and interact with people who have been in traumatizing situations and how valuable that would be to this kind of organization and the work that they were doing. And these are the kinds of things you can't necessarily teach people, but oftentimes people see this and they gravitate to it. And for certain jobs in public health, it's very essential
Yeah.
to have these types of soft skills